Hi, I'm Dr. Jeff Forsley with Lamont Natural Healthcare. In this presentation, I'm going to discuss what to eat and what not to eat when you have a thyroid condition. Don't eat your vegetables. Actually, it's don't eat your goitrogens. Goitrogens are foods that block the production of thyroid hormones. Thyroid hormone is the master metabolism hormone. You can have too high or too low thyroid levels. The most common abnormal thyroid hormone level is low, or hypothyroidism. So any factor that decreases thyroid hormone production can not only worsen your condition, but also may be a major cause. There are many goitrogens. The most common are broccoli, cabbage, kale, spinach, cauliflower, and soy products. Next, let's look at what to eat and what not to eat. What foods should you avoid? Obviously goitrogens, but also foods that are causing an immune reaction. This includes food allergies and food sensitivities. Food allergies involve IgE and are a histamine reaction. The symptoms are severe and start quickly after ingesting that specific food. You obviously know if you have a food allergy. Food sensitivities involve IgG and IgA. This is not a histamine reaction. The symptoms associated with food sensitivity start 24 to 48 hours after eating that specific food. Symptoms may be severe, but may also be mild. You really can't tell if you have food sensitivities without proper testing. So avoid food allergies and food sensitivities to help your thyroid condition. Another very important food type to avoid is processed sugar. The average American ingests over 150 pounds of sugar per year, way too much. Excess sugar intake leads to high cortisol levels. Cortisol is a stress hormone. High cortisol levels will down-regulate TPO, the enzyme that produces thyroid hormone. High cortisol levels also prevent the conversion of T4, the inactive form of thyroid hormone, to T3, the active form. So a balanced intake of sugar can dramatically help your thyroid condition. Finally, be careful about taking in too much iodine. Iodine and tyrosine, an amino acid, make thyroid hormone. But too much iodine can actually make your thyroid condition worse. Proper testing is necessary to determine your iodine levels. So what should you eat if you have a thyroid condition? Your diet should consist of proper percentages of good fats, natural carbs, fruit, and high-quality proteins. Certain fruits are higher on the glycemic index and should not be eaten too frequently. The glycemic index reflects how much insulin is released when you eat a certain food. The lower the food is on the glycemic index, the better, as this balances blood sugar. Good proteins provide tyrosine, which makes thyroid hormone with iodine. Please note that studies show that taking tyrosine and iodine to make more thyroid hormone doesn't work. Lastly, you can have a good diet that provides all the essential nutrients, but if you have digestive problems, you may not be absorbing those nutrients. So the phrase, eat your vegetables, takes on a whole new meaning if you have a thyroid condition. Your first step on the road to your thyroid recovery is calling our office for a free consultation.